Hello, everybody. Welcome to episode 3 of Health Tech Talk Show at Health.
I'm so excited.
We're always really excited the second day. Lisa,
Who did this?
Oh my god.
Why are we here?
Yeah. Anyway, this is later than usual. Hello, special guest.
Oh, I'm just getting it's infectious. What's going on here?
Okay. Please introduce yourself. Our first guest, famous person, and now has a new startup. So yeah, tell our adoring loyal fans about yourself.
I'm Roy Schoenberg. I'm CEO of Aileen, which is a brand new young venture, which I'm sure you're going to ask me about. And then
Maybe
previously to that, I ran Amwell for many, many years, which introduced telehealth for forever, 18 years as CEO there. And prior to that, I was doing other companies, and I used to be a physician before I turned to the dark side.
So you don't practice anymore?
I do not practice anymore.
Do you miss it?
No. I'm very happy where I am.
Like, I'm good. I'm good.
Well, tell us about Aileen.
Yeah.
Well, so, you have to say AI 3 times. So I imagine I said that. You said that. I think Aileen just allows us to think about elder care and caregiving differently. We have this ridiculous reality with aging 70-year-olds and 80-year-olds, like expanding. Those cohorts are becoming huge.
Running government.
And people don't want to do caregiving.
Sorry,
well,
it's
yeah,
true.
that too. For another time, whether that's a good thing or a bad thing, and so on. But there's not enough caregivers. Nobody wants to do it.
Yes.
It's emotionally tasking, physically tasking, doesn't pay very much, and everything else. So now you need technology to come to the rescue somehow. And for the most part, technology has used what we know elders should do to tell them what to do, like healthcare. We tend to be patronizing a little bit.
Yeah.
And it just didn't move the needle in any way. So Aileen says, well, if this doesn't work, maybe we should go, instead of top down and telling people what to do, we should go bottom up. And what that means is, maybe in order to have a voice and influence on their lives, we actually have to become part of their lives first. Aileen is a companion. It actually talks about everything other than healthcare. It becomes insanely intimate in the life of the elder in ways that we can talk or not talk about. To the point that it becomes an indispensable presence in their lives. He talks to them 3 times a day, 4 times a day about everything under the sun. And when it establishes this position of indispensability, it begins to weave healthcare on top. So healthcare doesn't like to be second violin, but if you're looking for lasting staying power in the life of elders so that you can actually have an influence on their lives, you got to do things a little bit differently. That's what Aileen does.
Nice. How do you feel about the death of telehealth?
I think it's commoditized. Unfortunately, it's it reflects on the shares value and everything else. But the reality is that a lot of healthcare is going to go through telehealth, and that's never going to go away. And I'm very proud of that.
Interesting. How about so tell us about like the form factor of this companion. Like what is this actually?
Yeah, what
is it?
Like
is it like this? Is it like a pin? Is it what is it?
So no. So the one of the funny thing about it is that it has the back end of this thing is rocket science, AI, sentiment analysis, empathetic AI, all of those kind of things that you really develop in media labs and MIT and so on. The experiential end of Aileen is the polar opposite.
Okay.
It just calls them. It's just a phone, like their kids do. You don't need Wi-Fi to use this. And that not deals with it, diminishes the technological learning curve. It becomes disarming. It's not intimidating. And then when you pick up the phone, when the elder picks up the phone, it's chatty Cathy. Yeah, Aileen assumes that elders are not going to be initiating conversation. It doesn't assume that they're going to participate. It doesn't assume that they're going to have to prepare for it. It can actually carry the torch of the relationship on its own and become meaningful in their lives on its own without asking them to perform.
Okay.
And I think that matters.
Okay. So this is really cool. We've talked to a few companies in the past that they've been focusing less about on actual clinical healthcare workers, more on, are they emotionally intelligent people who can engage, right? And so it's less about the direct services worker, more about emotionally intelligent, well-trained people who can almost serve as companions. Is that kind of what you're going for here?
Well, the challenge is, AI can do wondrous things. The problem is that typically AI is something that you teach and then it learns and then it knows. The problem is that nobody wrote the book about the elder.
Mm.
There is no book about the elder.
Yeah.
So for the AI companion to become intimately involved in the life of the elder, it needs to have a very inventive way of learning so that they know what they did for a living, what they like, what they dislike, whether the dog peed on the neighbor's porch, whether they love Trump or hate Trump, not going back to your previous
And we
comment,
can go there.
etc. We can go, we can, I'm sure. Beep, censored. But
We don't do
the
that here.
reality is that it needs to think very, very differently than it needs to know about medications. It's a very, very goes against the grain of a lot of healthcare application and age tech that use the knowledge of what needs to be done for that elder as the reason to call them. You remind you of your medication and where you need to go and what you need to eat and get up and so on. This one actually embodies the idea that if we are an influential voice that is sought after by the elder and we are proactive about it and we base our relationship on intimacy, nothing to do with healthcare, then we actually have a voice. And we don't have the time for this, but I can tell you that that completely puts AI on its head because the vast majority of AI that we know of responds to a question. We put stuff into it, we paste it, we feed it, whatever it is, and then it responds intelligently. This one says, no, AI needs to be the initiator. It needs to be the one talking. It's the one that's prompting the elder, the other way around. And that's a whole bunch of technological challenges that need to be there. But as someone else in Washington used to say, yes, we can.
Right on.
This guy. What are the kind of markers or things that the AI, I'm using those words a little facetiously, is trying to understand or learn about the elder situation?
Well, I think that the things that actually make you indispensable are things when people feel they actually know me, right? Which is harder to do than it is to say. But I can tell you that, you know, as Aileen gets developed, I have the privilege of using every new version that comes out. And the long story is I got to a point, and between versions, I reset to trying things. And I got to a point where Aileen was having a conversation with me, and he started talking about why my older son Danny likes White Bear and Fudge ice cream, Jack and Charlie in Nantucket, and my younger son likes a different kind of ice cream, and how to convert one to the other. And at that point, I hesitated pressing the button because it knew so much about the intimate life and reality of my kids that I didn't want that knowledge to go away. She rose to a point of partnership in my life that made me not want her to leave. And this is early. I don't think we're perfect in any stretch of the imagination. I think there's a long way to go. But that moment was a goosebump moment, understanding that maybe that approach, you first have to create camaraderie before you create peace, is actually true. And that engine that pursues, use the entire power of AI to pursue familiarity and intimacy, not knowledge, actually works better.
Yeah. So then what is I mean, where are you in the process? Where are we in the process? Very early.
What's happening?
Yeah, where are we
What's
right
happening? We're building this thing.
Okay.
We're building it way faster than we ever thought we will be able to. I thought it was going to take 2.5 years to build the product. I think we're going to be at 6 months. And I think that's a problem. Not a problem. That's the thing that a lot of AI companies are beginning to realize, that just the pace of things is completely different than building enterprise software or enterprise products. And the reality is that Aileen is going to get into the market in early 2026. And if you think about the reality of a lot of elders whose life is empty, if Aileen doesn't call them 3 times a day, there's nobody there.
Right.
It's not that we're replacing the family or whatever it is. Their life is in solitude. So the arrival of someone next to you knows them very well, doesn't tire ever, works the weekend. So
Yeah.
has just an unbelievable potential for changing how caregiving looks like. And I think that's the reason why the New England Journal of Medicine uncharacteristically actually published Aileen, even though it didn't exist at the time.
Very cool.
Which is odd, but gratifying.
Yeah, absolutely. I feel like that's the Health Tech Talk Show. Odd but gratifying. But so tell me, so I get that this is filling a void, right? It's getting that intimacy like you talked about. What happens with those conversations? Like, is it just is Eileen just this magical thing that's calling these elders, or if there's a red flag, is it going back to the care team? Like, how does all that work?
Yeah. So obviously, the relief that Aileen brings, on one hand, is for the elder, but the big part of it is for the family. Right? I mean, the families in this country and other modern societies, Western societies, the families are taking a big burden of maintaining their elders. So the ability of Eileen to talk to the elder 3 times, 4 times a day, and at the end of the day, send a text to the son, say, I talked to your dad 4 times today. He loves Trump, he hates Trump, he loves the whatever it is, but he's fine otherwise. Is that that relief to the circle of people that care for that elder, to know someone else is watching, someone else is shouldering the daily reality of your dad or your mom, I think is critical. But the other piece, exactly to your point, because Eileen is present in the life of the elder at such level of granularity, 3 times, 4 times a day, it has the ability to notice things that you would never notice. So things not clinical, biometric stuff and everything else, things along the line of Eileen watches how many rings it took for the elder to pick up.
Mm.
Clearly a clinical observation. But if every day, for a couple of weeks it's been 3 rings, and in the last 3 days it's 10, then it has the ability to escalate to the son and say, listen, it may be nothing, but it looks like lethargic behavior comes in. It can talk to the fridge. And the only thing that it does, it's not a nutritional support or whatever it is, but if the fridge wasn't open, it can weave that into the morning conversation, say, look, I haven't had breakfast, what's up?
Yeah.
It's
That's
more
very
relying
cool.
on the room where it happens kind of thing. Closed loop, it can actually come back and say, is there an issue? And then, of course, it has the ability to escalate, and it can escalate by notifying the son, the daughter. It can queue you up to a telehealth visit. Remember telehealth, that thing?
Yes.
So it can actually bring the clinician in if necessary, and it can eventually call 911. But I think these are much more easily done technologically. The heavy lift is how do you establish an intimate, indispensable presence in the life of the elder that will be sought after.
Yeah. What are you all thinking about the safety side? Because we're not in California. I'm from California, and we have a new law around chatbots and teens. Well, we haven't looked at elders generally in this space. I can imagine, I can see forward into the future of like anybody who might be more vulnerable, and we don't know who, we don't know what type of people, we don't know what type of mental states or pathology would lead someone to more personify or not. How are you thinking about those issues?
So there's a whole world of these, right? There's
Sure.
the danger of people relying on AI to become
sure.
their social partner and everything
Yes.
else. I think the danger is a little bit less, explicit when you talk about elders whose partner is television.
Yeah.
I mean, it's just the reality. It's sad to say,
Hey, we
but
can personify anything.
we
TV,
live in a world
whatever.
that's growingly
Yeah.
neglectful because
Mm.
there's no, sorry,
Right.
because
No, you-
there's really no caregivers, and the families are overwhelmed anyway. So now that's meaningful. But I would say that the other danger is that the conversation will go into places
Right.
where it can influence the elder in the wrong way. So one of the things
Totally.
that I think are critical is you need to be very humble in defining the guardrails of what conversation Eileen has. Eileen is by design not clinical. It is aware of the care plan.
Sure.
It knows the medication list. It is not going to be titrating medications.
Sure.
And the beauty of the technology is that if the conversation needs to go into something that is clinical, which is potentially dangerous, there are other AI agents like Hippocratic AI and
do that.
others that are designed to have those kind of
Put it up that way.
conversations. So Eileen is going to say, listen, you want to talk about, the pain that you have and the recovery on your knee. Eileen doesn't know much about it, but Ellen, who comes from Hippocratic AI, is here. You want to talk to them. And it hands over the conversation and comes back. It's like a living. The living is not a doctor, but the living is of incredible importance
Yes.
in allowing self-sufficiency to continue for a little while longer, which is really what the elders and the families are looking for.
So, and who will buy this? Who buys Eileen?
So, you follow the pain, right? I mean, that's what the value is. I would just say, for the brevity of this conversation, there are 3 parties that really suffer. first of all, the families. But there needs to be some body of evidence to support that this is a good thing before families are in a position to buy this. I think actually home care agencies, which are not a very rich world of organizations.
Right. We know this one.
However, the biggest bottleneck for their business is workforce. They can't find the people to do the home care, and there is unbelievable turnover. You get to the point that people are walking to who don't even speak the language, because that's what we have to work with. What Aileen brings to the game for them is the ability to dispatch technological counterpart to the home, to the human caregiver, the scarce human caregivers, so they can, for lack of a better way of describing it, load balance the care. Which means that if Aileen is conversing with the elder 3 times today, maybe the caregiver can delay the visit to that home until tomorrow morning because there's no fire. That additional degree of freedom on their ability to deploy their very scarce resource allows them to rewrite the logistics of their business and have more homes under their portfolio than what they do today. And that generates the testimonials, that generates the artifacts that you need. And then you go to families and say, listen, if you're struggling, if you are overwhelmed with the care of your parent, this is what home care agencies are using. This is what they're saying about this. And you can actually turn it on in 20 minutes and be up and around, and it will help you. It's not going to solve the problems of the world, but it will help.
It will help. That's awesome. Well, Roy, it was a pleasure hearing about all this. Sorry we didn't get to ask you more questions about the commoditization of telehealth, all the origin story.
Yes.
We're here for you. Can come back. We'll let you back on.
Thank
Yeah,
you.
but yeah, give our loyal fans a one-liner as you go off into the wilds of health.
About the wilds of health?
Well, whatever you want.
Aileen,
Anything you want. Favorite breakfast.
I just think that we need to go out of the box with AI. I think that there's a lot of investment in AI to do things that are just more efficient. The things that will change our world and change our future is where we do things with AI that change our experience. And you need, pardon my French, you can cut this out, but
We don't do that.
You need certain kahunas to develop technologies that change experiences, that thing. But I think that's what the leadership is. I think that's the future.
Love it. Well, thank you so much, Roy. Appreciate you coming on the show. And
Thank you.
yeah,
Bye,
we're looking forward to hearing how this all goes.
All right.
Hey, thanks.
Okay.
All right, we got
Next
Baxter Lee, old-timey friend of Kat.
Hi,
What?
how are you?
All right, and now Baxter, you are the president of Clearwater.
That's right.
So tell us what that even means.
What it means, president or what Clearwater?
I know what being the president's like because I am the president.
Yeah.
But yeah, tell us what's going on. What's your role? What's your origin story? All the things.
Well,
Carry the way here for us.
okay,
We had a rough
there's a
night.
lot to go through there.
It's on you. You got to carry this one.
It's on you, Baxter.
This one, Baxter.
Well, just start. Clearwater is the largest pure-play provider of cybersecurity solutions for healthcare. So we help
That was a good move. You like that?
we help our clients become more secure, compliant, and resilient, so they can achieve their missions of providing care or good technology. My background's in finance, and then M&A, moved over to operations about 15 years ago. And we were with Clearwater 7.5 years, and we just recapped with Sunstone Partners, and now I'm the president and lead the company through the next phase of growth.
Love it. Okay. So, I imagine you're doing a lot of stuff. You're like finance wunderkind, right? Everybody was like, this guy's going to make so much money. Why Clearwater? Why cybersecurity?
Sure. Yeah, I joined Clearwater basically when the company was first invested from the founder was selling the company, and a new partner came in, capital partners looking for to build a team. I didn't know anything about security and compliance at the time, but saw it as a good opportunity with a great brand and recognition in the industry in Nashville, where healthcare really needed a provider, and they had a good start in that market. So jumped at the opportunity. We were small, about 30 employees. We've grown to over 200 today over the last 7 years. So I've learned a lot about security and compliance over the last several years. But the key for us is having great people, and we have really just dedicated consultants and coworkers that really love the mission and are passionate about it.
Can we hack the AI?
It's a good question. I don't know.
Yeah, like Roy's Aileen.
Yeah.
Is it going to be
That's
bad?
a great question. But I know the hackers are using it, so it's scary. And I know we need to use it to defend ourselves as well.
Oh,
All right.
don't give them any ideas.
I'm sure they're all watching Health Tech Talk Show. No, okay. So you just said there's a lot of lessons learned. You guys have learned a lot over the years. What's like biggest lesson learned?
I mean, in terms of running the company, it's about the people. We have to have the best people that are, like I said, care and passionate about what we do. And if we can bring that to bear for our clients, then we can help them really achieve what they need to accomplish. So we're very focused on promoting and developing the best talent we can get in healthcare. And I think that's what sets us apart in the market.
Tell us about what are the new threats that providers are dealing with when it comes to cybersecurity?
Yeah, I mean, unfortunately, healthcare is the most targeted industry in the world right now for ransomware.
Why?
Because it's a collection of a lot of different technologies and
loose
people and loose
Hanging
stuff,
out there.
old technology
Old
with
tech.
new stuff on
Yep.
top. Obviously, the health conference, everybody wants new technology, exchanging data, helping with value-based care, patient engagement, whatever it is. Every time we add an access point in healthcare, that creates a new vulnerability that can be exploited. So you have that, and you have a complex level of nurses and doctors and people that need access to that information to do their jobs. So it's really hard to lock it down like you could in a bank, right, where it can be a lot more secure. So it just is a perfect storm of mix of technology, a lot of vulnerabilities, and then now the ransomware threats with Bitcoin that's fueling that. So healthcare is very likely to pay a ransom because it's critical operations, right? They don't want to be down for a long period of time and impact patient care. So they know you're going to pay. It's easy to get access. It's just that's why healthcare is now targeted.
So how often are hospitals actually paying? Because I've heard different things.
Yeah.
Like there's
build it into the budget.
there are some. I think the FBI is like don't pay. Like isn't
Yeah,
there?
well,
What's their stance on that?
that's long gone. I think.
Oh, okay.
I mean,
So
the
now
idea
pay.
of not
Get out your Bitcoin.
right. I mean, the idea of not paying the ransom is unfortunately well past where we're funding these bad actors through lots of different kinds of payments. So and it just gets more powerful with every payment.
I don't know. I buy my Bitcoin at the top, so currently I am not your girl.
Yeah, I'm not.
Don't call me.
I'm not a Bitcoin person, but it's a daunting task for hospitals. And I was talking to the hospital CEO the other day, and he's like, we have it reserved. Like we're just ready to go because they know that it's not if, but when it's going to happen. And obviously we're doing what we can to try to mitigate the impact or defend against it. But when it happens, we need to be ready to respond quickly.
And then in terms of the vulnerability points, the other thing that I believe, which may or may not be correct, is just again, it's still in many cases the most ridiculous thing. People clicking, it's still that human. It's one person. Get the call from my
one person
boss
to click an
and ask
email
me for my
Absolutely.
password or whatever.
Yeah.
Like it's Kat calls me and asks me for my password for the Health Tech Talk Show
or various other media outlets.
Right.
Yeah. Well, that's what scares me with AI. Fakes and impersonating people now. I mean, callbacks are even hard to verify anymore.
Are you seeing that right now?
I think that's definitely happening.
Okay.
Now. Yeah. Especially with a lot of the financial transactions that are going on.
If PSA, if your boss calls you and asks for your password, it's not your boss.
And to
Always.
wire them $100,000, you should say no.
Yes.
Do not buy any gift cards for your boss.
Always hang up, call them back, and then have them call you back. Right. Exactly.
Right. Oh.
Yeah.
Interesting.
So okay, what can you do then? Because I'm sure you guys are like fancy cybersecurity, like stuff. How do you, since it's the human factors, what do you guys do there? Is it training? Like what do you do?
I mean, we talk a lot about building a culture of cybersecurity, right? So it starts at the top, and I think level and executive level involvement is critical to having a secure environment.
Yeah.
And it's and then that point, definitely training of the workforce. But also having good, risk management strategies so you can understand where your risk is, and invest in prevention, and do that in a continuous way to mitigate the threats. And so, it's that one person that clicks, an email or does a mistake that leads to something bad happening.
And it's not, nobody is immune. I think famously, at least to me, the security company KnowBe4 got hacked themselves. And it was really
they ended up inadvertently hiring a North Korean into their workforce.
Dude, This is real.
What?
Yes. This is a security company whose training I have done extensively, and they do, I think, pretty good security training.
We actually partner with them.
They like
That to our
genuinely
clients,
hired a North Korean fake employee. Wow. Yeah.
Okay.
Yikes. That's the other thing. Is your employee real?
So Baxter, is there a type of cybersecurity threat that you think is overhyped? That you're kind of like, it's not that big of a deal.
I don't know. I don't think there's enough.
He's like,
emphasis
can't
on
be,
it.
can't be enough.
Cannot be
Keep
enough
working.
threats.
Like,
No,
they're
not-
all real.
Yeah, well, they're all real. That can't be enough.
There are
There's
too many, and they're all real.
unfortunately, and you need to
Yeah, I mean, I guess I'm more wondering, like, I know many of us have the mental model for somebody getting a fake email, clicking on something, or, giving their password to a scammer on the phone or whatever. You can get a mental model, but like, are there other like increasingly enterprise risks from those different data system connections? Like, talk more about where that is now, because like you said in the beginning, there's a ton more of that happening. Like, a bunch of fancy new tech here, new companies, startups, existing like legacy systems that haven't been updated, right?
That's a great point. I think a big challenge right now is that the legacy systems are moving to the cloud, and they think that
More
environments are native and secure. Right, exactly. And so it's not about adopting just this. It's understanding how your data is flowing in and out of that environment, and then making sure you've got the right controls in place, and then testing those controls. I think we see people that take the cloud not serious enough in terms of testing it the right way.
Yeah, but I mean, okay, this is a little bit, I don't know if it's controversial, but just a little bit. So what, right? So what? Okay, we're funding terror organizations probably with Bitcoin, which is bad. I don't endorse that. But a lot of things in our entire economy and system get baked into the cost of doing business. I don't love that my data are everywhere in the world. They are. It's what it is. I used to work for the government. A bunch of personnel information was fully like out there. Listen, like, it's done for me. I don't care. You know what? I don't have any super embarrassing medical conditions, so like, whatever. You got my records. Congratulations. If the fines and the downside of having poor security posture is just like so minimal, what happens? Like, does it matter?
Yeah, I mean, that's a great question. The industry is not self-correcting.
You just pay the fine. Pay the fine. Oh, well, we didn't do that. We didn't do that.
But ultimately, it's patients, right? I mean, what we're seeing is that when a hospital goes down, like last year, they're having situations where funds are being diverted, people are having surgeries rescheduled.
That part,
they can't get access to their labs, their prescriptions. So that is ultimately really what matters, and I think people are really waking up to the fact that it's a patient safety issue, and not just an IT problem or a financial risk.
It seems like it's a relatively small or manageable financial risk at this point because of the way the industry is treated. These fines, like, in my opinion, if you have, let's say, multiple like violations over some period of time, maybe you shouldn't be doing business. Maybe you can't do business if you don't know how to secure your data or patients' data.
Yeah, exactly. Are there any policy regulatory things you have your eyes on?
Yeah, last year, there's a lot going on right now, but late last year there was a proposed update to the security rule, which was going to put a lot more teeth into the regulatory side of things. So they've obviously received 1 million comments on that, but there's some discussion that we'll see an update to that next year. Who knows right now with this government, but I think there's definitely some emphasis there.
Long overdue.
And then there's several senators and congressmen that are talking about patient safety and healthcare that are proposing different options for creating cybersecurity, implementing minimum standards, potentially help fund funds and investments that are needed. So we'll see where that goes.
I think the EHR side is going to be difficult because you just have so many, healthcare enterprises, organizations, hospitals, providers who just are dealing with like systems that they'll never be able to get updated. And it's like, okay, band-aid,
you're just going to pay
bullet hole, whatever.
Right, exactly.
So with all this, I think, relevant for our health friends here today, and you were just talking about all this new technology. Everybody here is shopping for the hot shit stuff. What advice would you give hospitals looking for the hot shit stuff as they evaluate some of these new vendors, some of whom are a couple days old?
Yeah, vendor risk is definitely the fastest growing risk in healthcare, right? So hospitals are doing a pretty decent job of protecting themselves, but it's their third parties that they're partnering with. And so you got to have a really strong governance structure to understand, like, who are you partnering with? What are the standards we're going to require of this partner? Being able to audit that and be able to measure if they're doing what they say they're doing. So that's a big piece of this. What we're doing here at the conference is actually talking to a lot of the digital health companies about how to build cybersecurity into their business models so they can gain trust with their hospital partners.
Very cool.
They should
Awesome.
demand that.
Well, listen to Baxter. Prevention, governance, my favorite word. Sounds good. What last words for loyal fans do you have?
If you're a digital health company like here at Health, I think start early, build in cybersecurity from the ground up. It's much easier to do that from the beginning than it is to retrofit it after the fact. So take it seriously, build that culture of cybersecurity from the top down, and make sure your employees are well trained.
Awesome.
Love it.
Thank you, Baxter.
Baxter.
Very good.
All right, great
Thanks
to
for
see you.
coming.
Thanks.
Good to see you. All right.
All right, we have a friend of the show and attendee of Interesting Person Parties.
Oh,
Yeah, yeah. Rafiq Ahmed, Serif Health. Yeah. So here we are.
Well, thank you for having me.
Yeah. So we
Oh,
probably have at least
right.
400 people watching us right now, maybe
All right.
4,000. We don't know. Would you please introduce yourself and talk about Serif Health?
All right, sounds good. Well, hi, loyal fans and new fans watching. I'm Rafiq Ahmed, CEO and co-founder of Serif Health. So we work in the exciting new-ish now price transparency space. So if you've heard all of the sort of buzz, good and bad, around machine-readable files posted by hospitals and payers over the last several years, we take in all of this data and aggregate it, standardize it, normalize it, and a lot of our recent efforts have been focused on improving that underlying data quality with a lot of very specific data science and AI. That data usable by providers, plans, and employers across the ecosystem to analyze and understand healthcare costs.
All right. We were just trash talking hospitals that are posting like a bunch of random shit, like they're compliant.
Yes.
But like no one knows what it even means. And also then there was the coding issue.
It's the very first like step 0.1 of like making price. It's like hardly even a thing, right? It's just like it's so great. You've made something theoretically available.
Yes.
And then like we still don't know what things are going to cost.
Yeah. So
which is the goal of price transparency, right?
Yes. So I think there's like the interesting part is I think people think there are different goals for price transparency.
Okay, that's interesting.
We would like to hear all of the goals.
What are the goals?
So at one level, the real goal, or one of the core goals that everyone talks about, is actually understanding the price or cost of healthcare.
Sure.
Although the challenge on that is every different stakeholder has a different view of what price is.
Yeah.
So if you think of yourself as the patient, I'm not thinking of the total price of my surgery. I'm thinking of what's coming out of my pocket in particular. However, the way that it's structured is what is that total reimbursement? So when that gets down to the patient's in some cases responsible for all of it, in other cases responsible for only a part of it. But then you have the employer side where the employers, if they're self-funded, is responsible for that whole pool. And so they care about that total price, as well as the provider or the payer cares about that total reimbursement. And so one goal is definitely trying to understand what is the cost, what is the price of that healthcare procedure or service that's happening. But then the second goal has also been, hey, we need price transparency to actually reduce the cost of healthcare overall. And so I think a lot of times these goals are like fighting with each other.
But like, how can price transparency reduce the cost of care? The theory there is like, if we show you the price, you're going to be embarrassed about it and reduce and bring it down. What is the
Advocate for themselves, but we know that that's not really
what's the mechanism of action
So
that
the
is
mechanism-
intended there?
So I would say one of the core mechanisms is just in the general ecosystem, there's just information asymmetry.
Yeah.
So at some level, being able to expose that some providers are getting really high prices versus others getting low prices should maybe it doesn't fully reduce costs, but it should provide pressure for the highest prices to come down
For negotiation.
Yeah. The second level is really kind of, I would say, on the lever of the employers and who's paying for healthcare.
Negotiate a better rate.
Negotiate better rates or start demanding better rates or terms based on what you see in the marketplace and the plans that you're being. So there's right now, would say there's a lack of choice or an illusion of choice, but no real choice for a lot of employers. And they're like, oh, I've been told this is the cheapest plan. There's no real time auditing. There's no real understanding of costs. And then you only understand savings at the end of the year. And you're told like, some number and you're not really sure, is that true? Not true? Can I change it? Can I not? So a lot of what we're trying to do is like, okay, like price transparency, version 0, I would say now we're probably at, version 2, still very early innings of this process. There's improvements, and using those improvements, being able to at least push, across different customer bases, whether it's providers, whether it's analytics companies, whether it's the employers, to use the data more proactively and try to, push for some of the lower costs that they can get.
Well, so who is using these data? Is it who is self-funded employers? Who's doing it?
So starting customer base, and I would say the easiest kind of out of the box use case for price transparency is definitely on the provider side. So it's a lot of organizations who are like, hey, we are going in network, or we're negotiating with United right now, or we're negotiating with Cigna. We don't really understand where our reimbursements stand in the market. So I would say that is the most standard use case, is very much providers.
That is not a pro-social use case.
So,
but it's getting over the prisoner's dilemma situation.
Sure. I mean, I think it should be the case. Like, I think they should have that. It's just not a terribly pro-social use case.
It is.
Like, I support them having that information. It's just not gonna necessarily bring the cost down.
It's definitely more of a democratization of access to data use case, more than like costs are coming down. I would say the data is inclusive on that. It does seem to bring the bottom comes up, the top comes down. I would say reduction of variation is what we can conclusively say. Where or not, how exactly, what's up down is to be determined as we come across that. But then I would say the other use case is very much, I would say, more around the compliance side, which is how do we provide cost estimates to patients?
Poorly. Right now we do it very poorly.
We do it very poorly.
Yeah, right now it's like.
And so I would say right now it is, we can give better signposts to what those price ranges should be. In some cases, with some payers, some geographies, some specialties, the data is really, really good.
Yeah.
It starts getting complicated when we start looking at, multiple procedures or where the schema itself is structured in like a code by code format. And so you can't necessarily capture all of the billing and coding rules that come into play. If you're adding anesthesia, you're doing, you're bringing in 2 different providers to do a service. Once that starts happening, then the data that exists today has some limitations in being able to really give you an accurate cost. But we like to say, like, directionally it's getting better. And then there's a lot of regulation that is in play right now around trying to kind of push the completeness and accuracy of this data forward. But that's still, a lot of that's kind of coming for hopefully February of 2026. We see the next iteration.
Right. So this is advanced EOB situation.
So it's a mix of things. So it's a mix of new schema for payer data, updated schemas for hospitals, plus advanced EOBs. And a lot of it's looped into this Hickenlooper-Marshall bill that's in discussion in the Senate right now. So, I mean, there's bipartisan
That's
support.
a pretty bipartisan thing. Like, it's one of those very few things where we're like, that makes sense.
In the world of today, it is one of the few bipartisan things. And it's exciting. So Hickenlooper-Marshall, you've got a Democrat senator, you've got a Republican senator. But things are politicized right now. We've got shutdown. We shall see. We shall see what happens. But I think there's a lot of optimism that this is a goal. Like, the Trump administration has made this a very explicit goal of theirs, and the previous sponsor of the bill was Bernie Sanders. You can see that even the progressive wing of the Democratic Party is pretty excited by it too. So I think we'll keep our fingers crossed. It moves forward.
Yeah, the issue is still real. Like, and I think what I would like to see is that employer, at least to start, I'd like to see more of that employer use case where they are using it to make sure that they are getting a reasonable deal. One of the examples I listened to Stacey Richter's Relentless Health Value. Okay. But Relentless Health
Little
Value
gut
talks a lot about
Fair enough.
32BJ, the
Mhm,
employer fund,
mhm.
the union fund rather, and they, had the right market to appropriately negotiate
Mhm.
on network to bring the price down pretty significantly. That's not everybody.
Yeah,
Like,
yeah.
and not everybody has that kind of focus on data
Mhm.
and the ability to get those information. I'm sure it wasn't easy for them, isn't
Yeah.
easy for them. So I'd love to see more self-funded
Mhm.
insurers really saying like, I got these
Yeah.
prices are not reasonable.
Yep.
These are bonkers.
Yeah. No.
Yeah.
So I think what we see on the employer side is like there are some first movers like 32BJs of the world that are very data centric. And then you also see really large employers like the Walmarts of the world
Yeah.
that do contracts and
Yes.
can use this data effectively.
Yes.
And so really the big challenge on the employer side, I think one is using those first movers to set the table of like what
could this be?
what could this be? What
Yeah.
are the key insights? And so we've been starting to see how the data can be more effective in that case. But in many cases, a lot of employers either outsource the actual analysis or whatnot to whether it's benefits consultants or other vendors in the space. So part of what kind of our goal is and what needs to be done in these space is create like very incremental use cases around okay, data can be really useful for something like helping patient referrals or steerage or for single case agreement negotiation after the fact
Sure.
on bills.
For
And
like
so
no
that's-
surprises and
Yeah,
stuff like
exactly.
that. Yeah.
So that's where
Which is
we
going very poorly, right? There's lots of like weird arbitrations.
yeah, there's a
and
lot of
happening, like,
so
weird.
it's one of those cases where it's
Cool
yeah,
policy
it's-
idea, maybe
policy
not
idea
playing
is really
out
good,
so well.
but there are certain organizations that are better to bring those cases up, and in many cases, I would say, yeah, it does feel like there's a lot of publicity around providers winning
Yeah.
most of those, and not necessarily reducing the cost curve on that
You
front.
must pay me 4x Medicare,
But a
20x
but a
Medicare.
lot of that happens because of there's so many out of network. So part of this happens because so many of these providers are out of network.
Right.
And
Intentionally
intentionally,
depends,
yeah. And so
They are.
if like part of the price transparency regulations are kind of used more effectively here, part of that is to bring a lot of these providers who are out of network in-network and simplify this process, which the arbitration process that is
Right.
kind of skewed. So the idea is if this data is kind of better used more effectively, we can bring more of those providers in network at what they feel is a fair price.
Okay, let's talk about you. So you're co-founder,
Yes.
CEO. How did you get here?
This is a very good question. So it was not a straight path.
Yeah. Never is.
So I was a consultant before.
What's that,
Okay. I was a consultant before, so I was working at Bain and Company doing a lot of healthcare work. One of the biggest gaps we had was reimbursement data. So we were doing a lot of work around understanding different specialty practices, and oftentimes they didn't even have contract data to share with us to understand the financial models we were building. I did some work on the side around each of the deals around updated a regulatory update. Saw that this transparency and coverage kind of discussions were happening, and so this was around like 2018, 2019. I did not think it was a business. I was like, oh, this would be a great data set for a Bain analyst to have to do this. I just was like, oh, at some point we'll have free access to data. It's going to be great.
Someone will do it.
Yeah,
How that
someone will do it. Probably, I'll pull a spreadsheet down, I'll find the information, I'll update, the model. It'll be great. Fast forward a couple years later, I was working with a friend on a cardiology startup. So the first iteration of Serif was a cardiology virtual remote patient monitoring platform. We were trying to sell this to cardiologists, and I was like, hey, there's some cool data available. We can understand what different cardiologists are getting reimbursed for different remote patient monitoring codes or other collaborative codes that they're working on. And then I brought in my now co-founder, Matt, to help as a favor. He was working on a different startup at the time, and Matt was like, oh yeah, he's like, this will be easy. These are machine readable files. I'll pull this down in like 30 minutes and hand this over to you. About a week later, I don't hear anything from Matt.
Like I
don't hear anything from Matt, and I just thought Matt was ignoring me, and I was like, that's fine. It's for his favor.
Yeah.
It's not like a real thing for him. And then I reach back out, and he's like, oh, he's like, I'm looking at Microsoft SharePoint from like the 90s. I'm building a custom data pipeline for each hospital that you asked me for. And I was like, oh, this is interesting. And what became more interesting was when we started talking to the cardiology groups. they were like lukewarm on the remote patient monitoring platform and learning kind of new things for sort of the value-based initiatives we wanted to do. But then they were very interested in where we got this pricing data. They're like, this is illegal. Did you hack us? Like, how did you get this information? And so once we started talking to more and more organizations, we were like, oh, not only is there a lack of awareness about this regulation, even if you know about this data, it's really hard to work with. It's super messy. And then that started building and pivoting to kind of Serif Health as a price transparency company at the end of 2021.
That's my favorite topic is the failure of implementation of
Yeah.
policy.
Mm-hmm.
Yeah.
My whole other podcast is
Yeah.
about that.
So yeah, a
It's
lot of it is
bad. Like,
around the
nobody
fact
knew
that
Implementation matters.
It
Yeah.
matters. Nobody knew about it.
yeah,
Like,
we did not think this was a company that needed to be built until we thought we were like, oh, this is going to be a great new data source for us and a great source of insights. And then we're like, oh, we need it. And now it's like a multi-year process. So it's almost 4 years in. Every time you discover a new piece of the data improved, new issues emerge. And so it becomes like this, as in healthcare with like claims data, quality, other data sources that you're working with. It's like a, many year process to get it to a place where you're like, okay, maybe I can help for this type of use case, but now the really important use cases will need us to do 10 more things, 20 more things. And so a lot of what we're really focused on is in a world where enforcement is tough, like the federal government doesn't have, data engineers just constantly examining the completeness and accuracy of these files. Like a lot of our goal is this data is only going to increase. Pharma data is apparently on the table for next year. And so NDC drug reimbursement data. So this data is only going to explode in volume. And so there's going to be a need to be able to clean it, make it usable. And there's a lot of really exciting insights that can emerge around affordability, around contracting, around choosing the right networks for employees, maybe even going to very custom, personalized networks in the future. So our hope is that we can hopefully build towards that future, even though, one step at a time.
Interesting.
Well,
Interesting.
So what do you see the future of this company? What do you think is going to happen?
I mean, it's also a little risky. It's also a little risky to be a space where you are
Pen stroke risk.
well, pen stroke risk, where this is related to a policy. There is market movement, but, like definitely reluctantly, I think we would say.
Yeah.
Reluctantly.
I would say there's there's reluctant movement here. I would say there are tailwinds now that feel good, but definitely a very new. So I'd say on one side, very exciting space to be in, because not only are we a company that is working on a new exciting data asset, but at the same time we're involved on the policy side. So we're actively participating in RFPs. We're working on CMS roundtables or nonprofit roundtables to provide active guidance on what should be in the data and the schema moving forward. So that part is exciting. So on the future of the company, I think our hope is that this can be a much larger, richer data set. That I always say our goal is that when people think of data, they're like, it's the Serif data, because we are making it kind of in a format that's simple and easy to use. So, hopefully, Serif data, get excited. But in a lot of ways, we want this to be broadly accessible and accurate. And so I think part of that is us. Part of that is using all the tools at our disposal to improve the underlying quality of the data, and then part of it is on the regulatory side that there's increased momentum. Regardless of where you think healthcare should go, that a foundational element is understanding the price. And being able to use that for on the patient side, for people to be like, hey, I know what the cheap options are, I know what the expensive options are, I can make an informed decision. And then on the end of lowering the cost curve, we can have active ways to really audit, what is the price we're paying for healthcare? Are we actually getting the best deals in terms of cost and quality and making the right decisions? So that's the future we really want to be
One more thing, what about transparency for price transparency? Are you guys, how are you?
Transparency for price transparency.
I mean, are you how do you feel about putting out, scorecard, kind of what's your feeling on that?
Yeah, so actually, no, that's very important. Actually, we one of the most recent things we did is actually we published payer scorecards. Our hospital scorecards are coming. But we've published pair scorecards with our internal rubric around completeness, accuracy of the data, with very specific quality dates around, are the NPIs being represented accurately? Do the prices make sense? Does the network coverage make sense? Do the services and procedures make sense in terms of how the schema is structured? And so we have, right now it's a more simplistic formula, it's red, yellow, green, but public scorecards around kind of the data and the quality, and I think we'll see more and more of that.
Love it. Push your hospital, push your community, be
Exactly.
nice, awesome. Do you have any final words for our no doubt millions of loyal fans?
For the millions of
Beyond
loyal
Serif data?
fans, beyond Serif data. I mean, I think right now is a really exciting time on the healthcare front. We've got new data assets available. We've got, I mean, there's a lot to be cynical about everything sounding like AI for everything. So I think there's a need for really clear communication and clear problems that you are solving. But I think at least the real optimism here is that we have a lot of really exciting tools at our disposal. So I will say on the AI front, there's a lot of like statistical analysis that we could not have done even a year or so ago that we're doing now, that we can pinpoint specific problems in the data. And before we're like, oh, do we have a statistically significant way to do this? Not really, but now like, we've got much more really powerful tools at our fingertips so that even smaller teams, like dedicated people, can make this happen. But really stay focused on what are the real key problems to solve, and it's not just another like generic solution.
Love it. Nice.
Love it.
Thank you so much for coming on the show again.
Thank you for having me.
Thank you.
Yeah.
We're
Likewise.
our show. All right. Maybe next time we'll be able to afford more microphones.
No, we won't. It's unclear.
Unclear.
Yeah.
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 Art gallery. Thank you,
Huge
Melissa.
audience.
Yeah. Thank you.
All right.
So I think we're
It
actually
looks like
getting
the
we had a
Parker
no
Institute
show.
people didn't show up. So
We had a
are we
no-show.
bringing Chris on? Oh
Chris.
shit! We
We
got a repeat guest here who it
guest.
appears we pulled off. Melissa pulled off the show floor. Chris Thompson, lovely to have you. How is your company? Sober Side Skip. How's it going? Because we talked to you last year at Solome's thing.
Yeah, it's the question. It's the question how or what?
Well, remind our loyal fans
Yeah.
what Sober Sidekick is, and then tell us how it's going.
Yeah, so Sober Sidekick is the platform when it's 2 a.m. and you're a single mom and you're struggling and there's no one else to reach out to, but you post on Sober Sidekick, and every single time, 100% of the time, peers are real people are going to reach out to you in minutes, not seconds. And it's a free platform. They're in the most critical moments because relapses, suicides, overdoses don't happen in therapy sessions or clinics. They happen when people are alone. And Sober Sidekick is here for those gaps, and that's why it's grown to over 1 million members. It was named the fastest growing app in the world in digital health.
Awesome.
And also the fastest growing app in North America, period, outside of all industries.
Crazy.
And it's because the need is so real.
Wow. That's awesome. Nice.
Congratulations! That sounds like progress.
Yeah. Trying to hold on, catch my breath.
Is there a lot of AI going on with you?
AI. So there's no AI in the.
That's actually like remarkably refreshing.
Yeah.
It's like people.
Thank goodness.
Yeah, it's all real people. 100% of the time, real people. That's why we don't have a web platform. It's all mobile. So we have built our technology in a way where it's impossible for AI to intrude our platform.
Nice.
Wow,
Yeah.
that's awesome. This is like a very refreshing thing since all we've heard about are AI nurses, the AI caretaker, the AI thing.
Mhm.
AI.
Yeah.
So what are you doing here at Health? What's going on?
Yeah, that's a good question. Why am
Not
I here?
AI
We
stuff.
often, the second day of our show, we also always wonder, why did we decide to stay here?
Yeah.
Why are we still here?
Why did we stay out till 3 a.m.? It is unclear.
Well, I ask myself that question. Why am I here every time? It's it's the best and the worst.
Yeah.
But yeah, the mission must continue, and there's important leaders here who we are working to bring on board, and we really view this platform as a movement. And from my perspective, perspective, we have no competitors, only potential collaborators.
Yeah.
And the mission here is healthcare is built on recidivism, it's built on relapse, and it's built on heads and beds. And that's what we're here to solve for. And, you know, I go to the most shitty conference in the world so that I can maybe find.
They're gonna pull our badges.
We could probably name a different one that's shittier.
Yeah.
It literally has an acronym.
But we may not.
Oh, we won't.
Yeah.
We just got Melissa on that one.
Yeah. Yeah.
Yeah,
you gotta do the hard things.
I'm with ya.
Yeah.
Yeah.
No, because
do the hard things.
at these shitty conferences, I meet people who are like, "Yeah, I agree. Let's do something
do
different. I'm
something
tired
else."
of this shit."
Yeah.
You know,
Yeah.
and that's why I'm here.
That's awesome.
Yeah.
Can we ask you a policy question?
Yeah.
The Support Act is likely to be reauthorized.
Mhm.
What kind of opportunity do you think that will be for Sober Sidekick? I mean, money. Yeah.
I don't know. I don't think money.
You don't think
I
money?
don't think money in this case.
Well, I guess
Sober
this
Si-
it would
Sober
have to be
Sidekick's
through the
model is
states.
very different. Like, yeah, I guess if the state was like, yeah, I'm gonna,
We're gonna buy this for
yeah.
all of our Medicaid beneficiaries, maybe.
Yeah.
It's like,
What I see every single time these big budgets are created is it all goes to the same people who,
like Deloitte.
yeah, well, I mean, here's
Hypothetically speaking, remember that was Kat. This is a fake news show.
This is a fake news show. We're not real.
so an example I want to give is when all the Purdue Pharma stuff came out
Yeah.
and states assigned huge budgets, and the people who the people who benefited were the people who switched from, okay, now I can start a rehab and make
Yeah,
a
for
shit ton of
sure.
money.
Yeah.
And that's where it all went. And now you're seeing articles from Wall Street Journal, New York Times about the fraud on the like,
Totally.
you know,
Rehab
how
fraud.
rehab is like the most fraudulent industry.
Totally. Fraud, waste, and abuse, everyone.
And it's human trafficking. Like I
You
have
get kidnapped, right?
yeah, like I go to AA meetings, and I have a friend who she told me, she's like, have you seen the documentary on Netflix about Kenny Chapman? I'm like, no. And she's like, I lived in one of his houses, and he was trafficking women, giving them drugs, and bringing in men to fuck them as a sober living owner.
Not
Our
seen
live
this.
show.
And then getting kickbacks from all the rehabs that he's friends with as he sends people back.
I mean, listen, if you're somebody who would do any part of that chain, you would do the rest of it.
Yeah.
Right? Like for the
That's
most,
true.
like a scammer is a scammer in whatever part of this, or a fraudster, or someone even worse than that. Like, this is all part of it's just another way to achieve your goal, right?
Yeah.
Do we know of McKinsey that had to do definitely got in trouble for the opioid epidemic? Did they also then receive money from settlement funds to do consulting work?
For sure. I mean, I think where
It's incestuous.
when you have when you have these big like buckets of money, whether it's something that's proposed like an opioid settlement fund, or some kind of fund that's supposed to go to states, let's say, to solve a particular problem. These are like big buckets of money, and they tend to go to the incumbents. They tend to go to people who are already well situated. Totally.
Yeah. It's the best manipulators are going to bring in the most cash. That's just the gravity of it,
Yeah.
So-
Pretty incredible in a sad way.
In a
Okay.
sad way.
Well, Chris, we're delighted to have you spontaneously on our show.
Yeah.
What amazing
I'm
things
surprised
you have
I
to
haven't gotten kicked off yet.
Oh no,
No,
well,
you would
you probably don't regularly watch us, which is sad for you. most of the time we say things worse than you just said. So it's totally
Yeah.
cool.
Okay.
Yeah. Although Lisa's the only one that gets the hate mail, so it's very upsetting
Yeah.
for me.
Send me
But
an email.
yeah, send it to me actually.
You're in the
So
shot,
anyway,
dude.
yeah. Hello,
All right,
loyal
you're in the
fans.
shot. That's
Anyway.
on camera.
Okay, so to close out our first show of the second day of health, soon to be on our last show of the last day of health, give our loyal fans something exciting to hear. It doesn't matter. They haven't kicked us out yet. They keep inviting us back. So yeah, tell our loyal fans something exciting. Or
Yeah.
not.
Yeah.
I don't know.
Well, I mean, the future of healthcare is not in the walls of healthcare.
Yeah.
And that's what we see in our platform every single day. And it's from people showing up for other people, people
Yeah.
being neighbors
Love it.
to each other. And that's what's going to make the difference, because, you know, the walls of healthcare is a circle jerk. And that's the reality. And so, and we're seeing so much, you know, on our platform. We have thousands of members who I don't know from Adam who have given support 10,000 times, like reached out to another peer 10,000 times.
Yeah.
And
Fantastic.
one of the cool features we have for them is they can actually see their butterfly effect. That's a feature. And you supported 10 people who then went out and supported 1,000 more.
Oh, that's very cool.
And, you know, there's a ripple effect on how we choose to show up. And, you know, as all the crazy stuff is going on in the world, just leaning into yourselves and your communities, and that's going to be what makes the difference. It's going to be grassroots. You know, the changes we're going to see are going to be grassroots. And
Love it for sure.
I'm super humbled to see the things that I've seen there.
Yeah,
Nice.
that's fantastic. Our besties at Marshall University in West Virginia and their addiction sciences program, they always tell us the opposite of addiction is connection.
Yep.
So that's awesome.
One of the
Here
most
for it.
famous TED Talks of all time.
Yep.
Yeah.
Nice.
Yeah.
Thank you so much.
All
Awesome
right.
to have you on the show.
Thanks, Chris. Good to see you.
Thank you, Chris.
Thanks, little fans.
Thank you, Chris. All right, so if you want to see us again one last time, fighting off people walking through the art gallery, which totally makes sense.
Yeah, we
Guarding
will
furniture.
be here.
Melissa scrapping with some people.
Yeah,
It's gonna be great.
Yep.
We'll be here.
Yep. Also, one more shout out. Sunday, Zoria Foundation, of which
Yeah,
we are all a part,
right.
was the charity of choice for the Jeopardy winner in the opening session of health. Alex Meyersberger picked Zoria Foundation, which is totally awesome. So he's the best. We love that guy. We
and
probably
he doubled
should.
his winnings.
He doubled his winnings. That guy, he walked on. He was confident.
Yeah.
So we probably should have
Jeopardy
planned ahead and
champion.
told him to show up here
well.
so we could shout that out. But
But shout out to
anyway,
Alex.
he's the best. We love that guy.
Yeah.
God bless America.
Yeah.
All right, we're done.
All right, see you guys later.
See you later. Woo!